Thank you for watching the video. This is YouTube Medical University. In this video, we'll talk about something that can be directly linked to life and death. We're going to talk about subarachnoid hemorrhage. When you hear the term subarachnoid hemorrhage, what kind of symptoms come to mind? A sudden, intense pain like being hit with a bat. I think many people have that image. Actually, that's half correct, but also half wrong. Some people experience warning signs a few days before the severe pain, and some only have unexpected symptoms other than headaches. If you don't know this, lives that could be saved might not be. This time, from a doctor's perspective, I'll talk about the important and unexpected signs and warning symptoms of subarachnoid hemorrhage. I'll also share some nerve-wracking cases I've experienced in my outpatient clinic, so please listen until the end. So, in this video, first I'll briefly explain what kind of illness subarachnoid hemorrhage actually is. And in the second part, I'll talk about the crucial signs right before a subarachnoid hemorrhage that you absolutely must not miss, as they can determine the patient's fate. Finally, in part 3, I'll present 3 unexpected, carefully chosen signs of subarachnoid hemorrhage. Subarachnoid hemorrhage is not a disease that only affects the elderly. It can suddenly strike people in their 40s and 50s who are in the prime of their working lives. For example, Gen Hoshino and Giants coach Takuya Kimura. I'm sure you've all heard of them. Someone healthy just yesterday can suddenly collapse. That's what's so frightening about this illness. Most cases of subarachnoid hemorrhage are caused by an aneurysm, which is a bulge in a brain artery. Do you think this doesn't concern you? According to a study published in The Lancet, a world-renowned medical journal, unruptured, meaning not yet ruptured, the study found that about 3.2% of adults have a brain aneurysm. In other words, in a class of 30 people, about 1 person would have a brain aneurysm. Having a brain aneurysm does not necessarily mean you will have a subarachnoid hemorrhage, but you can see that it is not a rare condition. Seeing is believing. What occurs when a brain aneurysm ruptures? Please view this image. In the photo of the brain on the right, don't you see something in the center that looks like intestines? The left side looks dark, but the right side is white, isn't it? Actually, the dark area is cerebrospinal fluid, a clear water-like liquid. And this white part is actually blood showing up in the image. Since it's shaped kind of like a starfish, medically, this is called a starfish shape, or sometimes a pentagon. When a brain blood vessel bulges and ruptures, blood rapidly spreads in the brain. Subarachnoid hemorrhage is like a dam breaking inside the brain. Once bleeding starts, it immediately appears as an image on a brain-computed tomography scan. If too much time passes, computed tomography scan changes are harder to see, so waiting until morning isn't always best. If you have a headache, don't just leave it thinking it will probably get better. If you suspect it might be a subarachnoid hemorrhage, it's important to call an ambulance right away without hesitation. In the medical field, the so-called 30% rule is well known when it comes to subarachnoid hemorrhage. In fact, if you have a subarachnoid hemorrhage, 30% of people will die, and 30% of people are left with after effects, and the remaining 30% are able to return to society, according to the data. You can see how terrifying this disease is. And actually, there are sometimes signs that appear right before a subarachnoid hemorrhage occurs. In the second period, I'll discuss the signs that can determine your fate. This is called a warning headache, a subarachnoid hemorrhage. A warning headache is like a notice that arrives right before a major attack. What's happening inside the brain? The aneurysm is about to rupture completely. It is said to occur from several days to several weeks before. It's a sign that blood is slowly leaking out from a blood vessel in the brain. The symptoms include a headache that feels different from usual, or a strange headache, and pain that feels like tension in the back of the neck. Many people complain of these kinds of symptoms. Let me tell you about a patient I actually met. He was a man in his 50s. He said he'd felt like he was coming down with a cold for days and had a headache. He thought it was just because he had been working too much and that his shoulders and neck were stiff, and he asked if he could at least get some painkillers. He said that, unlike his usual stiff shoulders, the symptoms appeared suddenly and at one moment became much worse. He also mentioned that he took some painkillers, but the pain didn't go away completely. I thought maybe, just in case. When we performed a brain imaging test, we found a cerebral aneurysm that was on the verge of rupturing. Isn't it scary to hear about getting a headache when you have a cold? Some of you might be thinking that if it were you might not even go to the hospital. And actually, there is data showing that even for medical professionals, this kind of headache is very easy easy to overlook. This paper was published in the medical journal Journal of the American Medical Association. In the end, even though it turned out to be a subarachnoid hemorrhage, about 12% of people were misdiagnosed or overlooked as just having a regular headache when they first visited the hospital. Furthermore, when limited to patients who were fully conscious, about 19%, in other words, 1 in 5 people, were missed, which is a shocking result. Even doctors can overlook things. Just because you have a headache but are fully conscious and able to walk doesn't mean you're safe. Unfortunately, for those who were misdiagnosed or overlooked, the delayed diagnosis led to rebleeding and in some cases death. It also increases the risk of lasting after effects. As I just mentioned, the frightening thing about subarachnoid hemorrhage is that rebleeding can occur. There's a phrase, the devil's 24 hours, since rebleeding is very likely within 24 hours after a subarachnoid hemorrhage. If rebleeding occurs, the chances of death become even higher, so it's essential to go to the hospital as soon as you experience symptoms from the first subarachnoid hemorrhage and get immediate treatment. When an aneurysm ruptures and bleeds, a scab forms but then breaks, causing bleeding again. That's the image of rebleeding. So besides the obvious headache, it's important to clearly understand what other symptoms can appear with subarachnoid hemorrhage. If you know this and go to the hospital early, you can get immediate treatment or surgery before rebleeding occurs. Listen to the 3 main subarachnoid hemorrhage symptoms besides headache, which I'll discuss next. If you think there's no way you wouldn't get a headache with subarachnoid hemorrhage, you need to be careful with that assumption. There are other unexpected symptoms besides headache, so remember them, take notes, or share them in the comments. Musician and singer Mera Yoshikazu experienced a subarachnoid hemorrhage which interrupted his memory and left him conscious but unable to move. He ended up being taken away by ambulance. He discusses that experience openly in an article linked in the description or comments. Check it out if interested. It's about more than just headaches. Here are 3 unexpected signs of subarachnoid hemorrhage. The first one is this, drooping eyelids and seeing double. Yoshikazu Mera also talked about his experience of not being able to move his body, but eye problems are also common. Suddenly one eyelid can feel heavy and won't open, or you might start seeing double. In fact, I had a female patient in her 60s who, when she looked in the mirror after waking up in the morning, noticed that her right eyelid was drooping and hard to move. However, she said she didn't have a headache or anything like that. She was wondering if it was just because of her age or if she should go to an eye doctor. In the end, after some tests, it turned out to be a subarachnoid hemorrhage. Why do eye symptoms occur so easily? The cause is something called oculomotor nerve palsy. Oculomotor nerve palsy happens when a bulging brain aneurysm presses on the oculomotor nerve, which controls the eye, making it hard to move the eye, causing double vision, or making it difficult to open the eye. So, when you see double, it's not just an eye problem. It may indicate a subarachnoid hemorrhage, which you might miss if unaware. It's more than just headaches. Unexpected subarachnoid hemorrhage signs. Here are 3 signs. The second one is neck stiffness. Try looking down and touching your chin to your chest. If the back of your neck is extremely stiff and you can't touch your chin to your chest, this is called nuchal rigidity. Why does such a strange symptom occur? The cerebrospinal fluid connects the brain to the spinal cord. When the blood from the hemorrhage flows down to the spinal cord, it puts pressure on the nerves in the neck, causing pain and stiffness, especially when you bend your neck. The man I mentioned at the beginning also said that his neck felt stiff, but actually this was a clear sign called nuchal rigidity. 3 unexpected signs of subarachnoid hemorrhage besides just headaches. Finally, here is the third one, nausea and vomiting. Even if your head doesn't hurt that much, if you suddenly feel intense nausea, especially the kind that makes your stomach hurt, and you vomit violently even though you haven't eaten anything, throwing up with great force. In these cases, we suspect a brain disease. Subarachnoid hemorrhage means blood fills up inside the brain. When that occurs, intracranial pressure, or pressure inside the brain, rises quickly. As a result, we actually experience intense nausea as a sign. Often people vomit at that time, and when the pressure inside the brain rises, the vomiting is sudden and forceful, like a fountain. Even if someone says they vomited, there's a big difference between spitting up something like saliva and vomiting a large amount. So, when explaining at the hospital, it's important to tell them how forceful the vomiting was and how much was expelled. I've explained 3 unexpected symptoms. If you notice any suspicious symptoms, don't hesitate. Please make sure to see a neurosurgeon. This is especially important in cases like cerebral infarction as well. Please remember or write down the exact time and minute when the symptoms occurred so you don't forget. Knowing up to what time the symptoms were not present can also affect the choice of treatment. Of course, it's best to avoid a subarachnoid hemorrhage altogether. Lastly, I'll briefly talk about what's important to lower the risk of subarachnoid hemorrhage. The first thing is managing your blood pressure. If a blood vessel ruptures, it seems like you could prevent it by lowering the internal pressure, right? In a large-scale study conducted in 2019, it was found that just a 1-point decrease in the average blood pressure of a certain region led to about a 7% reduction in the incidence of subarachnoid hemorrhage in that region. So it's important to lower your blood pressure, even just a little bit. I've made videos in the past about high blood pressure and about exercises to lower blood pressure. I've posted them. If you're interested, check the description below. Another risk factor is smoking. If you have high blood pressure and smoke, your risk of subarachnoid hemorrhage rises sharply, about 15 times higher when both factors are present. If you're watching, you already value your health. If you think you're at high risk, watch more videos from YouTube Medical University. YouTube Medical University is aiming for 1 million subscribers. I would be really happy if you could subscribe to the channel so you don't miss any new videos. And for better retention, if there's even one thing you learned or want to remember, please leave it in the comments before you go. And if you like this video, please rate it with a thumbs up or even a thumbs down. Your feedback will help me with the next video. See you again in the next video. I've learned from my patients how to live well into your 70s and beyond without aging. I want to live this way too. I never knew it was possible. These stories I've been told are all packed in here. Chatting with friends is more important than exercise. When it comes to medicine, less is more. This is full of wisdom from my seniors on how to live healthily and happily at any age. Please check it out from the description below.